Oh, hi! I'm Lindsey Whittington from the Colorado Health Institute, the principal investigator for the Colorado Health Access Survey, or the CHAS. For each survey, we analyze responses from about 10,000 households in Colorado. And because we gather data from a large sample of people, we can confidently say the CHAS represents Coloradans from every region of the state. CHI has been fielding the CHAS every other year since 2009, so our data shows trends that help us understand health in Colorado. In this video, I'll show you how people around Colorado can use CHAS in their work. We'll start with a local leader. Maria runs a nonprofit in Alamosa that hosts weekend wellness clinics for kiddos twice each year. 2 years ago, her organization expanded clinics to 3 additional towns in the San Luis Valley, and she wants to know if their work is making an impact. An easy first step for Maria would be to pull up the CHAS data dashboard by typing colo.health/CHAS dashboard into her browser. She can also go to our website, coloradohealthinstitute.org, click on CHAS on the top menu, and look for the link in the dashboard. Maria can use the Map tab to see how her region compares with the rest of the state on topics like general or oral health. She can select different variables to show the data in different ways. Or she could click on the Demographics tab and see how different variables like age or race ethnicity affect different outcomes, like mental health. Another tool Maria might find helpful is the regional fact sheet for her health statistics region. To find these, she would navigate to a specific survey year, then look for the drop-down menu or box called Regional Fact Sheets. These fact sheets show data by broad categories like insurance type, affordability of care, health status, and social and economic influences on health. In most cases, she can see how her region compares to the state average. Regional fact sheets show key statistics that are the same for every region, but the regional workbook is an Excel file that breaks out more of the CHAS data by health statistics region. Tabs along the bottom contain instructions and other resources like statewide averages. The remaining tabs break out the data by region. Maria can scroll through questions and data from 2009 to today. She can navigate by year using the colored tabs at the top or search on specific terms using the search bar. Maria can see what questions were asked on the latest survey by downloading the survey questionnaire. She can see it as a PDF or an Excel file. Either way, she can scroll through the questions or use the search function to find key terms. CHI produces a report of initial findings when we launch a new survey, then continues releasing briefs on various topics over the next 18 months. Maria can use data and graphics from these analyses as long as she credits CHI. If Maria can't find what she needs with these resources, or she doesn't have time to dig through the data, she can contact me at the address on your screen. We can respond to some data requests for free, but have to charge for more complicated requests. But don't worry, we'll work with you. Now, let's talk about CHAS tools that legislators, state agencies, and local government officials can use. Casey is a former nurse who is now a county commissioner on the Western Slope. He sees his neighbors struggling to pay for rent and food and wants to understand how these social factors affect their health. Like Maria, he can use the dashboard, briefs, regional fact sheets, regional workbook, and the questionnaire to find data about his region. But Casey can also dive deeper into popular health topics in Colorado, like general health and affordability, by downloading one of the workbooks. Similar to the regional workbook, he can click on the colored buttons at the top to find data for that year, and the different tabs along the bottom break out the data by demographic categories. When Casey meets with state legislators, he likes to be prepared by reviewing CHAS legislative fact sheets. These give him a quick snapshot of health issues in their House or Senate district and statistics to use in conversations. Legislators and lobbyists can use these fact sheets to find partners to co-sponsor a bill or justify policy proposals in their region. And watchdog groups can also use them to hold elected officials accountable. Finally, meet Alex. Alex is a master's student working on a capstone project about barriers to care in Sheridan, Colorado, a community with many Spanish-speaking residents. Researchers, analysts, and students like Alex can benefit in different ways from CHAS tools. They use the CHAS questionnaire as a model for survey design, choosing to use tested questions in both English and Spanish from the CHAS for their own survey. Alex downloads the public use file and data dictionary, a free dataset that they can analyze on its own or supplement their own survey's findings. They can also dig into the sampling methodology document to understand how the CHAS is conducted and anticipate any data decisions that they will have to make for their project. To get the most detailed CHAS data, Alex submits a request for a research file by completing the application form. So whether you're using data to support decision-making, policy, research, or something else, the CHAS has tools to help you understand Colorado's health and act on it. Explore the tools at colo.health/CHAS and let us know how we can support your work.